The U.S. could soon have 2 more coronavirus booster shots on the market. The FDA has authorized additional doses of Moderna and Johnson & Johnson's vaccines. Now the ball is in the CDC's court. An expert panel is expected to vote on the matter soon. Meanwhile, the White House is detailing how it plans to get kids aged 5 to 11 vaccinated. Federal regulators will be meeting to discuss data on Pfizer's pediatric shot in the coming weeks. Nikki Battiste has the latest.
Tonight's FDA authorization covers Moderna recipients who are 65 and older or at high risk because of their job, living situation, or underlying health conditions. Any J&J recipient 18 or over is now eligible for a booster too.
By giving additional doses of vaccine to people who've already been vaccinated, we're further reducing their risk of severe disease, hospitalization, and death.
The FDA also authorized mixing vaccine brands, but did not weigh in on whether recipients should stick to a single brand if possible.
If you got a Johnson & Johnson vaccine, you do get a bigger boost in your antibody levels if you get the Pfizer or Moderna vaccine as your second dose.
Meanwhile, the White House announced it's ready to ship 15 million vaccine doses for the country's 28 million children ages 5 through 11 in anticipation of emergency use authorization by early November. The plan is to work with pediatricians or primary care centers, pharmacies, schools, and rural health clinics to distribute the vaccine with smaller needles and doses. There will be no mass vaccination sites.
Kids have different needs than adults, and our operational planning is geared to meet those specific needs.
Today, New York City ordered its roughly 300,000 municipal workers receive at least 1 vaccine dose by the end of next week or have an approved exemption. Otherwise, they will forfeit their pay.
Our message is simple. Get vaccinated, keep with us, keep us moving forward. Anyone who isn't will go off payroll onto unpaid leave.
Starting today, New York City employees who get their first vaccine dose in the next 10 days will get a $500 bonus. If cleared by the CDC, the Moderna and Johnson & Johnson boosters could be available as early as Friday. Moderna's booster would be given 6 months after the second dose, while Johnson & Johnson's would be 2 months after the first dose. Lana?
All right, Nikki, thank you. For more, let's bring in Dr. Elizabeth Claiborne. She's an emergency physician at Capital Region Medical Center and an adjunct assistant professor of emergency medicine at the University of Maryland School of Medicine. Welcome, Dr. Clayborne. So the FDA has authorized booster shots for some recipients of Moderna and Johnson & Johnson vaccines, as you heard in the report, and as you're well aware. In the case of Moderna, this applies to vulnerable populations. And for Johnson & Johnson recipients, all people 18 and older are recommended to receive a booster. Explain why these different populations are getting different recommendations.
Absolutely, Lana. So these recommendations were really based off the FDA evaluating the data that looked at how antibody and immune response were waning after several months. So in the Johnson & Johnson group, they did see that there was a significant decrease in antibody levels, and it saw that there was probably a need for this group to have a 2-dose regimen, and that's why they've opened it up for pretty much everyone who's had a J&J shot be open to getting a booster. Additionally, they have looked at the data of how your immune response to getting a booster by an mRNA vaccine such as Moderna or Pfizer could actually add to a more effective, robust response from your immune system. And that's why they've made suggestions that J&J recipients, when they boost, could go with the same vaccine or choose an mRNA vaccine, which I think has been shown to be more effective, and that's what I would recommend. As far as the Moderna group, that group is still in general showing really good protection against hospitalization and severe disease. However, there's a subset of the population, older people, those with weakened immune systems, and especially those who are in high-risk working environments that may need to boost because they additionally do have some waning level of protection, and boosting will help to kind of foster those antibody levels and ensure that they're protected after, the several months when we see the decline in the antibodies from the initial series of the vaccine.
So I want to follow up with you on the point about Johnson & Johnson's vaccine, because if it looks like it should have been really a 2-dose regimen, as Pfizer and Moderna are, might we be looking at the potential for an additional booster after somebody's received their second shot of Johnson & Johnson if they're in one of those vulnerable panels? And obviously, given that the CDC panel is expected to vote just on the initial part of this matter on Thursday, know that there isn't a recommendation yet. But I'm wondering if that might be something that the medical professionals are really trying to evaluate at this point.
Yes, I would say that people have to remember that this is a moving target. We are all learning as we go. This is a new virus. It's a new pandemic. We are all looking at data from across the globe as we get millions of people vaccinated with these vaccines. We learn about their effectiveness and what is going to be needed in the future. And it had always been on the radar that this indeed might be an endemic virus, that meaning that it will be here forever, the way that the flu is. And as you know, we get flu vaccines every year. So it had already been proposed that we might potentially always have to boost for coronavirus as well. Now, that hasn't completely borne out. We have to see what the data shows. Those who are boosting right now, we'll see what happens. But I think that people have to remember, just because recommendations are changing doesn't mean that the vaccine is not effective. It is actually showing that it is very effective. It just means that we are being very diligent when looking at the numbers and deciding when we might need to boost. And I think in the future, it's always possible that an additional booster might be needed for Johnson & Johnson as well as the other vaccines.
Well, I'm glad that you brought up the flu, because a new government-backed study found receiving Moderna's booster shot alongside the flu shot is safe and effective. I'm wondering if you're recommending this to your patients.
Yes, Lana, I definitely think people have to remember we are entering those winter months. This is flu season. And the flu, just like the coronavirus, is likely to be more dangerous and more transmissible in these months where we are in closer contact with other people indoors. And the flu can still be very deadly to people, especially, again, those high-risk groups, those who are immune compromised, older, or who have other issues that make them a higher risk for being exposed to sick individuals. So I definitely recommend that everyone gets their flu shot. That's what I've always done as an emergency physician every year. When I talk to patients, I encourage them to get their flu shot. And this year, I will be encouraging everyone to get their COVID shot if they have not, as well as their flu shot. And as you mentioned, there's been some studies that have shown that it is indeed safe to get both shots at the same time. So you might as well just double up, get your double jab, and make sure that you're protected through these winter months.
Go ahead and prepare for a sore arm, I guess. Actually, right. When you're speaking about these winter months, it's interesting that the CDC is predicting that hospitalization rates are going to remain flat or even decrease. This pandemic obviously going on for a year and a half at this point. Do you know, Dr. Clayborne, are we at the beginning of the end? What are you seeing there on the front lines?
I certainly, in my personal experience working in the emergency department in Maryland, have seen a steady decrease over the last few weeks. I also have noticed that we haven't had quite the acuity or severity of illness related to COVID as we had seen through the end of the summer months. And that was promising. It continues to be promising. Now, I do think part of why we're seeing this success is that we're actually finally getting to those vaccination rates in the United States where we might be getting, herd immunity or better protection. More people are getting on board. But there is still a huge subsegment of our population that have been eligible for this vaccine and choose not to be vaccinated, over 66 million people that fall into that bucket. And so those people are generally at really high risk, especially in the winter months. Those are the ones I really focus on. Every time I have a patient that tests positive for COVID, especially if they're unvaccinated, I ask them to share that story with their family and their friends to illustrate that this is still deadly, it is still killing people, and it still can impact you and your family if you are not vaccinated. That said, as we get higher vaccination percentages, I think that we'll have a steady decrease in our case positivity rate as well as our deaths and hospitalizations. And I hope that's what we have to look forward to. But the winter months are more dangerous. There's more indoor activity, there's more travel. And so we need to be vigilant and keep encouraging everyone to get vaccinated who is eligible.
Dr. Clayborne, before I let you go, I want to ask you about a new CDC study that found an increase in adults seeking mental health treatment and medication over the last 12 months. Can you talk to us about the impact that this crisis has had on the doctors that you work with, the nurses, the other folks there in the hospital that are seeing this and confronted with this on a daily basis? And now that the cases are on the decline, what is it that our healthcare professionals need?
I'm really glad that you're bringing this up, Lana, because it is definitely something that I personally, I think, have been grappling with over the last year and a half. My job is already challenging as an emergency physician, and in the era of COVID, it's been especially challenging. Not just because I'm, pronouncing people dead, I'm talking to family members who are very sick, and I'm fearful for my own safe and healthy. For my family and myself, but because we're all stretched to the max. There is a severe nursing shortage going on across this country. A lot of us working in hospitals and clinics have been overworked, and it is a very trying time. And so I think that you have seen an increase in people basically having symptoms of depression, anxiety, being stressed out. I'm hoping and encouraging all of my colleagues that work alongside me to always seek assistance when you need assistance. Reach out, call somebody, because we tend to be the type that just kind of sucks it up and says that we're doing okay even when we're not. And I think that we're going to see a huge fallout from this for years to come. I mean, people might really have long-term implications from working during this pandemic. I gave birth last year while pregnant on the front lines. I mean, it was a very traumatic time, and I think that we're all looking forward to that returning to normalcy, but it will never be the same. So please, if you ever are in a healthcare environment, thank your healthcare workers. Be patient with them. Be nice to them. Remind them that you appreciate the job that they're doing, because we are all working very hard for you.
Well, we appreciate you so much. I mean, you guys have been running a marathon for the last year and a half, and you don't even know where the finish line is, and yet you still find time to come on and talk to all of us. Dr. Elizabeth Claiborne, thank you not only for joining us, but for all that you do.
Thank you.